All right, perfect. Great. So thank you everyone for tuning in and for being a part of this, what's going to be Naboso's webinar series, where we share a lot of the latest research and topics around barefoot science, sensory stimulation, obviously textured science, and then really diving into some of our new education that we're launching as well, which I will talk about at the end. So just a few formalities before we jump into that content is one, this is being recorded, of course, unless you just logged in, this is being recorded. So just in case if you happen to log off or get disconnected, you need to go, don't worry, we will be sending everybody a recording of this. It will also be sitting on the Naboso YouTube channel, so you will be able to share that and access that again. In addition, if you want a copy of this PowerPoint, I will absolutely share that with you. All you have to do is email me info@naboso.com, info@naboso.com, and I will make sure that you get a copy of this PowerPoint. There's some interesting research, so you may want to reference that again. I will share that email address at the end. After we do the actual educational part, I will open it up for any questions. So if you have any questions at any point, you can type that into either the chat or the Q&A part of the upper bar. I will be checking both of those, so the chat or the Q&A. Okay, enough formalities. Let's dive into this content. So first off, welcome, thank you. My name is Dr. Splichal. I am a functional podiatrist. I am the CEO and founder of Naboso. I'm also the founder of EBFA Global. So if you're not familiar with EBFA, we are a global education company that I started in 2010, so quite a while ago, where we offer education to health and wellness professionals, where everything is built around feet from the ground up, fascia, barefoot science, sensory stimulation, everything that I'm deeply passionate about. And that really was the foundation through which I then started Naboso, where Naboso would be the product extension of EBFA Global and our education. And then in addition to that, I have a book that I have authored called Barefoot Strong. We have that available at either barefootstrong.com, which links you to Amazon, or it is also available on naboso.com. My email address, I am easily accessible. Well, you can access me, and then if you don't hear from me, make sure you hit me up again, Dr. Emily at naboso.com, and then do follow myself and Naboso on Instagram. Naboso had already mentioned, Naboso is a sensory product line that is designed to stimulate the hands and the feet. I will go into a few of the products towards the end, but again, want you to focus and understand that this is purely educational. So when we typically think about sensory stimulation, stimulation of the feet, primarily, whether that's through the Naboso products, through barefoot stimulation, through vibration, minimal shoes, a lot of the focus that our mind goes towards is on movement. So if someone were to initially think of the Naboso insoles from a medical perspective, your mind would probably go towards helping people who have decreased sensation of their feet, feel their feet so that they can improve their balance and reduce falls. That's a very movement-centered benefit or application of sensory stimulation, which is true, it's valid, it's powerful, and it's necessary. But what I want to focus on in today's webinar is going to be that there's actually a benefit beyond just movement-based, just beyond balance and stabilization. This is where we're going to take a dive and look at the impact of sensory stimulation on circulation. And circulation in our feet specifically, that circulation of our feet is extremely important. And it's important from a health perspective, a longevity perspective, a healing perspective. If you get a cut on your foot, obviously you need to have good circulation to heal that. But our nerves also need to have good circulation as well. So there's this powerful impact that we want to be thinking about in our clients and in our patients and ourselves is what is and how good is our peripheral circulation. I hope that you're thinking about the circulation, your larger cardiovascular circulation. I sure hope that you are thinking about circulation to your brain as well. That is extremely important from an anti-aging perspective. And then from an anti-aging foot health perspective, it would be the peripheral circulation to your feet. Now, typically, we can think about movement. Just the act of moving itself is a great way to drive circulation. And the way that movement drives circulation through your entire system is because of the ankle movements when we walk. When we go from dorsiflexion to plantar flexion, you move your ankle, you are activating the calf muscles, and your calf muscles are referred to as really your second heart. This calf pump is important. It's necessary as a way to get venous return back into the circulatory system, because if you're not getting good venous return, you're not going to have a good arterial flow. So the arteries going into the veins, and this has to be this continuous pump to drive the cycle. So in some of our clients or patients that are not so ambulatory, maybe because of a stroke or MS, or they had surgery or something, they then start to get some of this circulatory compromise. They might get swelling in their lower extremity because they're not activating this pump. So movement in itself, or the ankle calf pump, is a very important driver to circulation. So it's, again, another one of those benefits. If you are trying to think of every reason possible to keep moving from a longevity perspective, circulation and the driver of circulation is going to be another one of those. Okay. And that circulation, again, is not just, thinking kind of what's close to the heart. It's what's happening in our fingers and our toes, and then all the way up into the brain. So a real quick aside on that is that certain walking speeds. So walking speed, I recently did a webinar for EBFA about walking speed as a predictor of longevity. And really, some of the reasons for this is that if you do not walk fast enough, you do not activate enough of this circulatory pump and this driver, so you don't have enough blood pressure and blood flow to get up into the brain, and cerebral blood flow is extremely important for preventing cognitive decline. It actually drives up brain-derived growth factor. So very, very important to be keeping moving from a longevity circulatory connection or perspective. So now my question that I put on the table, and that we're going to be discussing in this webinar, is what is the effect of sensory stimulation during movement? So we know that movement in itself, walking, increases circulation because of this calf ankle pump that exists. But can sensory stimulation on its own improve circulation? And what happens if you combine sensory stimulation when you're walking? Do we actually get a compounded increase in circulation? So let's get diving into the content here. So when I say the word perfusion, and sometimes I like to get into a little bit too technical, maybe that's one of my faults, is I get a little bit too cerebral in things. But this word perfusion, so perfusion you could think as synonymous with circulation. And when we think circulation, again, a lot of people are going to be thinking about kind of a larger heart pumping aorta, so these larger blood vessels. But what I want you to also appreciate from a circulatory perspective is that there's this much more complex microvascular capillary system that exists in our bodies, that the circulation you want to think about with your clients, specifically in the feet, because that's what we're talking about, is going to go all the way into the skin. So that's going to be the perfusion. So skin perfusion is the oxygen that is perfusing through the skin to then maintain integrity of that skin. This is actually a big part of podiatry, is understanding, studying, assessing skin perfusion of the feet, because it's so important in diabetics. And if a diabetic starts to lose their skin perfusion, they are very high risk for an ulcer. And if they get an ulcer and they have decreased foot skin perfusion, then they're ones that are very high risk for potentially having delayed or chronic ulcers in their feet, which might eventually turn to gangrene or osteomyelitis and then eventual amputation. So huge, huge space within podiatry. But it's not just for diabetics. I want to really emphasize that. So when you're thinking about perfusion, so how much oxygen is getting to the skin, to the nerves in the bottom of our feet, so important for balance and stabilization. We said that way in the beginning, right? But in order to have peripheral nerves that are healthy, you have to have good perfusion, microvascular perfusion to these nerves. And then you also get perfusion and oxygenation to the muscles, right? That's going to help obviously strengthen those muscles and get them contracting. And then to your fascia, a big one being plantar fascia. A lot of research around chronic plantar fascial symptoms, fasciosis, is associated with decreased perfusion to the fascia, leading to degeneration. And I'm going to very loosely use the word necrosis, because necrosis really, some people will think like dead, and it's not dead, it just has decreased. So maybe more hypoxic would be the appropriate way to describe that. Okay, now when we're thinking about blood flow or perfusion, the things that it is measured off of is cardiac output. So how much blood is getting pushed out with every pump or beat of the heart. You have a vessel compliance. So this is really important. If you have resistance in your vessels, which your blood vessels actually increase their resistance with stress. So as you get into a sympathetic state, a fight or flight state, right, you actually increase the resistance and the stiffness of your blood vessel. So vessel compliance, we want to make sure that that stays down so that we don't have these stiffer vessels that we're trying to push into. Obviously, blood volume is important, right? So if you start to bleed, your blood pressure is going to go down, because certain amount of blood volume is important for our system to keep cycling through. Totally makes sense, right? That's when your blood pressure starts to drop. They give you an IV of fluids, and that's going to increase your blood pressure. Okay. Blood viscosity is a really, really important one that I'll be referencing all the way at the end as far as it references grounding. I'm a big fan of grounding. But blood viscosity, you could think of as the thinness of the blood or the stickiness of the blood. That's where people who are a high cardiovascular risk may be taking blood thinners or the baby aspirins, right? So that's addressing some of that blood viscosity. And then, of course, the diameter of the blood vessels. So if you have plaque formation, you are going to obviously narrow them. All of that is going to have an effect on your perfusion to the skins, nerves, muscles, and fascia. Now, unfortunately, the blood vessels that are all the way down in our feet are not only the farthest from the heart, from the actual pumping mechanism, but they're also the smallest. So you want to make sure that if you're trying to get peripheral, all the way distal to the tips of the toes, you need to have a good cardiac output, vessel compliance, blood volume, not sticky blood blood cells. You want to have decreased viscosity, and you have to have nice open blood vessels so that blood can get all the way down to the tips of your toes. Okay. Now, the way that you measure perfusion in the feet is going to be in various ways. Now, you might not be measuring it, but I'm just doing this for kind of a full understanding of skin perfusion. So there's what's called skin perfusion pressure is one of the assessments that you can do, a transcutaneous partial pressure of oxygen. So it's really how much oxygen is diffusing across the skin. This is one that is actually measured quite often in podiatry and in wound care centers specifically. So you want to be screening in certain patients, really their ulcer risk. And that's where a lot of the research, if you start looking into this topic, is going to be around diabetics, because of that ulcer risk. Skin temperature is something that you can look at. And then also a really important one is going to be muscle temperature. And that's showing that the perfusion that we're talking about is not just to the skin itself, but we need to get that circulation to the muscles so that they can contract and get that optimal strength for function. I thought that this is a fun picture. So this is a thermography image, and this is measuring the temperature, so the skin temperature. And this is specifically showing a diabetic patient. You can see, both feet. This is the top and the bottom of the feet. Obviously, the areas that have more of that red, orange, yellow, there's going to be a higher temperature. And then on the patient's left foot, you can see, look, you can actually not even see the digits. So it's not even just purple. It's not even being picked up at all. This would be a patient that if I saw this, it would be one that I would be very concerned of their digits on their left foot and be following them to make sure that there's no breakdown in the skin, because if they do get a breakdown in the skin, I would be very concerned of those ulcers healing because of this compromised perfusion that we're seeing. And that perfusion, the conclusion of the perfusion is based off of temperature, okay? Now, similarly, though, this doesn't have to be a diabetic. You can see similar thermography images around grounding. And grounding is this act of going outside and walking on the dirt and the earth. And a lot of the research around grounding has to do with decreasing inflammation, decreasing blood viscosity. So if you decrease blood viscosity, you are obviously going to be able to get that blood a little bit more distal to the tips of the toes. It also decreases the stress response. Remember, I said that stress causes resistance in your blood vessels. So there's more like pushback as the heart is trying to pump the blood out. If you decrease that resistance by decreasing the stress response with grounding, they actually show through thermography that you will get circulation post-grounding all the way to the distal tips of the digits. So that's going to be one of my takeaways is if you have not tried grounding or you're skeptical on grounding or you wanted to understand the benefits, this is going to be one of them is circulation, peripheral distal circulation of the feet. Awesome for that. Okay, so why is this topic important? Why am I doing a lecture on the topic of foot circulation or perfusion based around sensory stimulation? Well, it is important because of the important role of microvascular perfusion. So the other takeaway that I want you to think about and to bring to your clients and to your patients is that our circulatory system is not just these larger vessels, it is microvascular as well. And we can't see those guys, right? Oftentimes it is things that you cannot see that is actually very important within the human body. So microvascular circulation, this is to our skin, to our nerves, to our muscles, and to our fascia. You also have microvascular conditions into your retina. So it's really important to have retina. Obviously, your brain is going to have microvascular, and then also to your kidneys as well. So now I'm just going to briefly go through these. So wound healing. Oops, and I should have warned you. Sorry, there is a ulcer. So if you don't like wound pictures, I do apologize. And if you're listening to this just via audio and you're running back to your computer to see the wound, I didn't put a really, ooey gooey one. I could have. I saved you guys. So for wound healing, so skin, wound healing, perfusion. So this is one that if I had this as a patient and I saw this ulcer, right? So this is actually a break in the skin. So this is the soft tissue, the dermis that is showing under here. And then this is callus, right? So if you look at this and you saw this tiny little opening, that's not the size of the ulcer. This ulcer, I would actually debride and take all of this away. It would probably go from that about that big to about that when I actually opened it up. So if I measured the perfusion to this area with that transcutaneous, I would probably see that there's decreased oxygenation here. Okay, and then that's going to delay this. Now, pressure. Here's a big takeaway. Pressure distribution affects skin perfusion. Pressure distribution affects skin perfusion, skin circulation, okay? If I have constant pressure, excess pressure in one place, and that one place that I'm seeing it, and I can't feel my feet because of some neuropathy, I won't know that I'm shifting all of my body weight under my submet 1. And then I get excess pressure and I break down the skin and I get an ulcer. Okay. So when we think about the importance of, let's say, Naboso to someone with a diabetic neuropathy, specifically diabetic neuropathy, and I will not just be speaking about diabetic neuropathy, so hang with me here, okay? If you have someone with diabetic neuropathy and they cannot feel their feet and you use the Naboso insoles, you are helping them to build awareness of their pressure distribution so that they do not have this excessive imbalanced pressure distribution, which is then going to compromise the circulation to certain areas of the foot. Okay. That's a way that you could see the Naboso insoles as beneficial to ulcer prevention for someone with diabetic neuropathy. Okay, we all need to have balanced pressure distribution under our feet. Someone with microvascular disease has to be even more aware of it, because excess or uneven pressure distribution can cause a breakdown in the skin, and then you get an ulcer like this. Okay. Balance and stabilization. So this is looking at the nerves. Obviously, you have to have healthy peripheral nerves because we need to stay stable and balanced and reduce falls. Again, this is really important in our neuropathies, but not just our neuropathies. It could be someone who is an athlete, someone who sprained their ankle, a child, right? Everyone needs to have healthy peripheral nerves. And to have healthy peripheral nerves, you need to have healthy microvascular circulation. Okay, that one is probably extremely obvious. Okay, to have healthy plantar muscles is important to how we absorb impact forces, how you stabilize the foot as an athlete, how you transfer force. So a lot of our larger functional movements and athletic movements are based off of having a strong foot. That's probably why a lot of you probably signed up, because you are into foot strengthening and barefoot training and minimal shoes, and you believe in that. This is part of that. Part of strengthening the foot muscles is that you need to have good circulation to the foot muscles, right? So it goes back to circulation as well. And this one I briefly mentioned in the beginning, plantar fasciitis and circulation. So having a chronic inflammation or irritation to tissue, in this case, the plantar fascia, you need to have good circulation to heal injuries, whether that injury is an ulcer like the diabetic ulcer that I showed, or that injury is to your plantar fascia or to another tendon in the foot. You need to have good circulation to whatever part is injured. So in plantar fasciitis, you get these micro tears that need to be repaired. The only way that you can repair those micro tears is based off of having optimal circulation, right? You need to bring the growth factors and the oxygen there to then heal that tissue. So this is a really interesting study that is somewhat connected to the sensory, but it'll connect to minimal shoes, which is sensory. So there was a 2019 study done by Sarah Ridge at BYU, and they found that narrow shoes, so how there's a slight non-normal foot shape, so kind of a tapered traditional shoe shape. When you have that narrowed shoe, it's going to move your big toe over, so it adducts the big toe, kind of like a bunion. And what they saw is that actually decreased the circulation to the bottom of the foot and that plantar fascia. So as soon as you're in that shoe and you push that toe over, you tighten all the connective tissue and the arteries that sit along the inside of the ankle. I thought that was super, super interesting. So if anyone wants another reason of why you should be wearing barefoot shoes or barefoot shaped shoes, it would now be circulation, right? You need to have optimal circulation, microcirculation to the bottom of the feet, for the skin, to the nerve, to the muscles and the fascia. Wearing minimal shoes or barefoot shaped shoes is necessary for that. And that's an awesome research study to support that. Okay, so who needs to think about foot circulation, microvascular circulation, and perfusion of the feet. Who are our clients and patients that we need to think about? Of course, the diabetics. I've been mentioning that quite a bit. Those with neuropathy, yes, that as well. Plantar fasciitis, especially those with chronic plantar fasciosis, you got to be thinking about those guys. Our aging clients, just because we start to get a little bit more cardiovascular comorbidities, right? So that's going to kind of compromise that microvascular or peripheral circulation. Athletes, you got to think about them as well. And really, everyone should be thinking about part of their foot health is the circulation of it. So really what I'm talking about is applicable and beneficial to every single one who is online right now and to every single one of your clients and patients. All right, so let's get into it. Sensory stimulation as a way to improve foot circulation. Sensory stimulation is a way to improve foot circulation. When we think about the nerves in the bottom of the feet, this is what we're stimulating with the sensory stimulation, right? It's the nerves in the bottom of the feet. The nerves in the bottom of the feet, if you are brand new to anything Naboso or EBFA, these are the nerves that you're going after. You don't have to memorize their names, but you should know what they are sensitive to. So we have the SA1, which is sensitive to 2-point discrimination or texture, quote unquote texture. You have the SA2 Ruffini ending that is sensitive to skin stretch. The FA1 and the FA2, these corpuscles, are both sensitive to vibration. So vibration. So when you're thinking about what is the stimuli that I need to bring into my feet to improve circulation, you want to be looking at texture, 2-point discrimination, skin stretch of some sort, and then vibration. So let's start with vibration. And the reason why I want to start with vibration is that 70% of the nerves in the bottom of the feet are sensitive to vibration. 70% of the nerves in the bottom of the feet are sensitive to vibration. So I'm going to be running through briefly some of the research studies that will connect vibration, specifically whole body vibration. So in this prior image, I am on a whole body vibration platform. This happens to be one by PowerPlate. And these whole body vibration platforms are a great way to mimic or induce the sensory stimulation or the mechanoceptive stimulation of vibration. There's many other brands as well besides PowerPlate. So here, first study, vibration and skin perfusion. So this is a 2020 study. The goal of that study was to look at local vibrations via whole body vibration on plantar skin blood flow. And they did this for 10 minutes at a 35 hertz. So the plate that I showed in the prior video, the baseline of that is 35 hertz. So this would be equivalent of using something like a personal power plate, 35 hertz for 10 minutes. And then they saw a significant increase in the skin blood flow when compared to sham vibration. Now, what's important, in addition to just seeing the research, which is confirming, right, is just take note of the time and the duration. Just take note of the frequency of the vibration. So the 35 hertz for 10 minutes, right? And then we saw this increase in plantar skin blood flow. Great. Validating the benefit of vibration, whole body vibration for skin perfusion. That would be the oxygen crossing the skin barrier. As far as vibration and muscle temperature, which is another one, this is where you could start to use some of that thermography. 2008 study, this is looking at muscle temperature in whole body vibration versus cycling, so an activity. Now, it is important to note that cycling isn't an impact-based exercise. It is a non-weight bearing or non-impact exercise. And then the passive warm-up in this case to increase the temperature is they put the feet in a hot bath. So what they saw is that the rate of muscle temperature increase was significantly greater during whole body vibration versus spinning or cycling and a hot bath. And they didn't see any difference between the cycling and the hot bath. Okay, now the last part about the metabolic rate with whole body vibration and cycling, that is important because of a larger cardiovascular response that you can see from whole body vibration that will actually compare to something like cycling. So let me just take a step back to kind of process that. So what they were seeing is that when you did just placing your feet on a whole body vibration platform, that increased the acceleration and the rate of muscle temperature increase faster than putting your feet in a hot bath or doing cycling. But if you compare cycling and whole body vibration, you saw a similar increase in the metabolic rate, okay, which is a really, really good benefit that you can get from whole body vibration. Now, what their conclusion was is that whole body vibration elevates muscle temperature in the feet quicker than traditional forms of cycling or a passive warm-up. The passive warm-up, again, they did a hot bath, but you could have done stretching and things like that. Okay, so really interesting to have that added as well. Another research study looking at vibration and blood viscosity. Remember, this is kind of that thickness or the stickiness of the blood vessels. 2008 study looked at the effect of whole body vibration on foot and leg blood flow. So this was a little bit higher frequency, so 50 hertz for 15 minutes. And what they saw was a decrease, sorry that the D is not on there, decrease of blood viscosity, which resulted in increased blood flow velocity. And what they attributed that to was muscle metabolic demands drove the increase in blood flow. Okay, so it went back to the muscles. So if you're wondering, okay, that's interesting, but why did that happen? What did the vibration do? The vibration, yes, it stimulated the peripheral nerves and the Meissner corpuscles and the Pacinian corpuscles, but the stimulation of those nerves drove muscle contractions, specifically intrinsic muscle contractions. So by getting the muscles of the feet contracting, you are then increasing the muscle temperature and the blood flow, the skin temperature as well. And why that is and what the science of vibration to muscle contraction is, this is going to be the muscle tuning theory. Now, we experience vibrations when we walk. So if we know that our muscles respond positively to vibration by contracting, and as the muscles contract, you increase temperature, muscle temperature, skin temperature, you start to get vasodilation. So part of working and work output is you get a vasodilatory response that then increases, you get the oxygen to it, right? You get your pump. Okay, so part of that pump is a vasodilation response. You get an increase in nitric oxide. Obviously, you get swell, right? But you are getting a temperature increase. And that is a muscular response based off of sensory stimulation, specifically in the feet. The muscle tuning theory essentially means that as vibrations come into the body, we need to damp them or stop them by contracting our muscles isometrically to stiffen and absorb the vibration. That's called the muscle tuning theory by Dr. Ben O'Neig. This in whole body vibration research, they call it a tonic reflex. So what happens is the muscles contract and relax in a very rapid rate that you don't notice it, but they're stiffening to damp the vibration that's coming through the vibration platform as a way to train this muscle tuning response. It drives circulation, drives a temperature increase, and that's also associated with that vasodilation. So again, where do we experience vibrations on a daily basis? Not just on whole body vibration platforms, but when we walk. So as your foot strikes the ground and you experience ground reaction forces, these ground reaction forces or impact forces are perceived by the mechanoceptors in your feet as vibrations. So we need vibration. Vibration is how we get energy from the ground. Vibration is how we build bone density, right? It's what stimulates your muscles, so it strengthens your muscles. It creates a fascial response, so it's healthy for the fascia. Now we know it drives circulation, so that's huge, right? Talk about what that does cognitively or to the brain. So many, many benefits as far as where we're experiencing vibrations. So we got to keep moving, okay? Now there is a study, a 2012 study that looked at walking and skin perfusion. Okay. And what they did is they used temperature again. Temperature is a great way to assess for perfusion. And they measured the skin temperature in walking. And what was really interesting is that the plantar temperature of the foot sharply increased after 50 steps. So it actually didn't take that long to start getting the temperature to increase. And what the theory of the driver of this temperature increase with walking is the vibration is inducing a muscle tuning contraction of your intrinsic muscles so that you can dampen absorb foam. Muscles then increase the temperature. So if that's the case, if vibration, which is sensory, when you walk, drives muscle contractions of the small muscles in the feet, increases temperature, increases vasodilation, increases microcirculation. The way that my mind goes is that I want my patients and my clients, and then especially my patients that are going to be potentially a ulcer risk. So let's just get into our diabetics, right? Into a ulcer risk with the diabetics, to be in shoes that allow optimal sensory stimulation when they walk so that their intrinsic muscles can contract. Now, there is some research that shows that chronic use of orthotics and arch supports can actually decrease and atrophy the intrinsic muscles of our feet. You can actually get denervation of the intrinsic muscles of your feet if you wear overly supportive shoes, overly cushioned shoes, and orthotics. So we would not want that, right? For our patients and clients. We need to allow optimal sensory stimulation when we walk to drive intrinsic muscle demands, right? So that of course means you got to go with the minimal shoes. The minimal shoes are going to help create strong intrinsic muscles. This is one of actually many studies that are out there now that will look at minimal shoes for running, minimal shoes for walking, strengthening of the intrinsic muscles. This is a 2014, and they saw that the minimal shoe walking was as effective as foot strengthening exercises for increasing foot muscle size and strength. There was a 21% increase in flexor digitorum brevis size. So perfect, love it. You want to add it even more? I know I'm a little biased, but I would throw the Naboso insoles in there because you want to get even more sensory stimulation. So minimal shoes will increase your perception of vibration because there's no cushion in the shoe that's absorbing the vibration. Traditional cushioned shoes with all that beautiful cushioning, think like a Hoka. The Hoka, the sole of the Hoka is actually damping the vibration when your foot strikes the ground. Now, there's theories that that reduces overuse injuries, but there's a lot of research that shows that all that cushion absorbing the vibration is taking your sensory stimulation so your foot doesn't have to do the work. We want the foot to do the work because that's what strengthens the intrinsic muscles, creating increase in temperature, vasodilation, and microcirculation. Okay, so we want to compound the vibration of minimal shoes with the texture and the 2-point discrimination, which is the SA1 nerve that I mentioned earlier. It's a different nerve than vibration, to further increase the circulation and the perfusion in the feet, right? Why would you not do that, right? If you could bring in more sensory stimulation when you're walking around, why would you not do that, right? We want to do that. So that leads us into texture. So texture as a way to increase skin perfusion. And we are actually in conversation with various institutions to do research with the Naboso insoles and a product I'm going to be sharing very soon to show and to demonstrate the increase in skin perfusion after wearing the Naboso textured insoles. And where we started exploring this is that we would actually hear a lot of anecdotal feedback from our users saying, I no longer need to wear socks. Like my feet are warm, even in the winter, me living in Alaska, my feet are warm in my shoes with the Naboso insoles. They're like, this is the craziest thing, right? We've also had some users that have had Raynaud's, which is a microvascular spasm, and they say they actually do not get those symptoms anymore because of the textured insoles with Naboso increasing skin perfusion. So let's just take a little pause here. We're just going to look at some of the thoughts. So this is more the thought or the curiosity of how texture could improve circulation. So your epidermis, your skin is made of the epidermis, and then below that is the dermis. Okay. The epidermis, which is the most superficial layer of your skin, doesn't have any blood supply. The microvascular and the nerve networks are actually found in the dermis. Okay, so you have to go a little bit deeper to stimulate the nerves and the microvascular system within the skin. And then look at the foot, right? Where is the skin in the body the toughest? Your foot. Right? It's very different than skin here, right? This is thinner skin, thin skin, right? So you have this thicker epidermis in the bottom of the feet, but then the feet is the part of the body that we need the most microvascular circulation. So to improve circulation, specifically in the feet, we need to stimulate the skin of the feet in a way that it can actually get deep enough into the dermal layer. That means that the stiffness of the stimulant needs to be stiff enough to get deep enough to get through the thick skin of the epidermis in the bottom of the feet, but not too stiff, because we don't want to break the skin, especially in a diabetic or someone with neuropathy, right? Or even just vascular disease. Okay. Now, prior mechanical studies have shown that localized pressure points can actually improve skin perfusion. Well, that was done on the head, and that was done on studies specifically for balding, right? So if you use texture stimulation on the scalp for those that are losing their hair, can you increase the perfusion, and then that circulation will help the hair follicles, and then they can help to either maintain their hair or to grow hair. Okay, now can the feet do the exact same thing? Theoretically, you would think so, right? So there's a study that looked, and this is what they used. So they didn't use Naboso, but stay tuned. So this is what they use. So these are just kind of some little prongs that they had created as a way to stimulate the skin on the bottom of the feet. And what they did is that they would roll it across the foot. So it wasn't just pushed straight down and then held it. For anyone who has the Naboso products, think like just standing on the neuro ball and standing in one place. Right? This was more like rolling through the neuro ball, walking with the Naboso insoles in, right? Or rolling these prongs, they call them turf-like prongs across the bottom of the foot. They did that for 3 minutes. And what they saw is that there was this significant increase in the skin perfusion immediately after they stopped this 3 minutes of a textured stimulation. Now it lasted, as soon as they stopped, it lasted for about 1 minute. Okay. The area of the foot that lasted the longest was right underneath that first metatarsal head. Okay. And then the areas of the foot that they noticed the most significant skin perfusion was going to be highest in the forefoot, and then the midfoot, and then the lowest in the rear foot. But that's actually great, because remember that thermography image that I showed, which is the part of the foot that was like black. It didn't even show up for that one patient. It was the distal, it was the digits, right? So if this research study is showing that cyclical texture stimulation to the foot for 3 minutes showed the most significant increase all the way down in the tips of the toes, that's actually great, right? And some of that reason could be that the most sensitive areas of the feet to stimulation such as texture is in the digits, not into the ball of the foot. It's actually, or into the arch of the foot. It's actually into the toes. Now, when they looked at a couple different stiffnesses of these turf-like samples, they noticed that the more stiff actually lasted longer as far as the skin perfusion. So maintaining and supporting that it has to be sufficiently stiff. Okay. Now, the reason why they propose that the rear foot, the heel, didn't get as much of a skin perfusion increase after texture stimulation is because the skin on the bottom of the foot is the thickest in our heels. Just think of all the dry calluses in the heels, right? Our heel skin is quite thick. So then that's where they're saying, okay, we just think that based off of that epidermis, they just didn't get down into the dermis to stimulate the blood vessels. So the conclusion of this research study, this is not my conclusion, this is the conclusion of the research study, said that the optimal method for delivering stimulation is in a cyclical way that is mimicking walking. So they conclude that it is in your shoes. Hello, Naboso, right? So bringing texture stimulation into shoes to increase a cyclical textured sensory stimulation, to increase skin perfusion is exactly what we want to do. Now, I add on there, or socks. So we have a brand new product, and I am giving you your announcement. This is launching in just a few weeks. So this is your very special opportunity to hear this first. So Naboso, we are launching a sock that is bringing our patent pending texture stimulation inside a sock. Now, inside this sock, you are going to see the texture that you have grown to love and understand the benefit of through Naboso. And this is wearing the sock for just a couple minutes. You can actually see the indentations that are happening in the foot. Now, if I had a thermography camera, I guarantee you that you would see an increase in temperature in the right foot versus a foot that had no sock on because of that textured stimulation. The design of these socks, very similar to the research and what it's saying, the stiffness of the pyramids is very specific. And it is something that we worked very hard with our factory to make sure that every single one of these pyramids is the appropriate stiffness to not harm the skin, but to bring appropriate sensory stimulation to the dermis through the epidermis to the dermis, so that we can increase microvascular stimulation to the skin, to the nerves, to the muscles, and to the fascia. So this is launching formally on the naboso.com website on November 22nd. So you are getting roughly a 2-week advance notice. We do wholesale on our socks. We actually do wholesale on all of our products. So if you are interested in pre-ordering and getting some of these socks for your patients and your clients on pre-order, you will obviously be getting those first. So all of our pre-orders we are fulfilling first. Please contact our co-founder and CRO, Michael. So Michael@naboso.com. This is really one of the most exciting products that we have launched. It took 2 years to develop this. So I'm really excited to hear and see the feedback that we get. And then the research studies that we're doing around the benefits of texture stimulation, appropriate texture stimulation that Naboso proudly stands behind, is the shape and the durometer of the stiffness and the materials that we use for our textures, very specific to get the result based off of this research that we just shared. So now I got a couple bonuses for you. So 2 bonus strategies as a way to increase peripheral circulation. Microvascular stimulation is going to be, first one, grounding. I absolutely love grounding. I mentioned this in the beginning. Grounding means that you are connecting to the earth. You're taking off your shoes and your socks. You're getting on the dirt or the grass or on concrete. You can actually do it on concrete as well. You cannot do it on wood floors. So it has to be on concrete and also not on asphalt. So stay on the sidewalk part of it. Okay, so grounding, what it does is it's based off of the charges of the planet. So things like electricity will actually recharge the planet, and we are to connect to that natural flow, this energy flow. So similar to how you ground appliances, I'm looking at the outlets in front of me, and there's that third prong. For those in the US, you will know what I mean. In other countries, might look a little bit different, but there's a grounding prong, right? In the outlets. That grounding is to stabilize the electrical system of the building, right? And then whatever you're plugging in. Same thing with us. We have an electrical system within our body as well, and we need to stay grounded to the natural charges and flow and energy of the planet. Research has shown that grounding decreases inflammation, decreases stress response, can actually improve circadian rhythms, and here we go, decreases blood viscosity. So it can improve peripheral circulation, and it actually is shown to improve wound healing. So very, very beneficial, totally synergistic with what we're saying here. And then the second one is going to be electrical stimulation. So this is an image of similar to a TENS unit. It's electrical myostimulation. This company is called Revitive. If you go to revitive.com, you'll see. And it is a platform that your feet sit on, and then it sends these electrical pulses that induce intrinsic muscle contraction. So it's cyclical, and when it contracts, you get the contraction, and then you get the relaxation, contraction, and then relaxation. So those bracing contractions are pumping and increasing the temperature of your feet and your lower leg, and that's also on a rocker board. So every time your muscles contract against the stimulation, your ankles move, which is getting your calf pump as well. So great product. I use that with a lot of my patients. And something really interesting with that is that for my patients that are just out of surgery or had a stress fracture or whatever the injury may be that they were in, let's say a cam walker for 3 months, let's say, I start them in this so that they can keep the muscles contracting. If you have someone who has a knee replacement, a hip replacement, something where they're not ambulatory because of a surgery or an injury recovery, get them on something like a Revitive, and then that's going to allow them to mimic walking, to keep the foot stimulated. You could also have the feet on a whole body vibration platform. And then of course you can be using the Naboso socks when they're hanging out on the couch, things like that. Okay. All right. So what I want to do is I'm going to open it up to questions. I see that there are some questions already there. If you want a copy of this webinar, please email me info@naboso.com, info@naboso.com. You will be getting the PowerPoint. You will be getting the recording. We are going to be doing a series of webinars once a month, so stay tuned for that. This is officially kicking off our webinar series, again, that we will be doing every month. And then starting in January 2020, we are working on a certification, which is going to be intended for health and wellness professionals such as yourself. So I am going to dive into some of those questions now. So this individual says, are there preferred grounding conditions? How about a house with marble? Or does it have to be in nature? So the best surfaces, I already said this briefly, is anything that is natural. So dirt, rocks, sand, right? You're going to the beach. Concrete, though, you cannot ground with shoes unless the sole is leather. You cannot ground on wood floors, even though the tree, which is wood, which is natural, once you cut the tree down, you actually do not get the benefit of grounding from wood. As soon as that tree is cut down, it's no longer electrical conductive. And then also you want to be careful with asphalt. You want to be careful with carpet. Those are going to block it as well. Okay. Typical recommendation, again, is 15 minutes. So just get outside 15 minutes and get that stimulation. If you do it, say, first thing in the morning or when the ground is actually wet, you actually ground better because of the electrical conductive nature of that water interface between the ground and your foot. Okay, great. So what are your thoughts on laser light therapy along with sensory stimulation? Love it. Love it. Thank you, Jesse. Jesse, very good friend. Great. I absolutely love red light therapy. And red light therapy, I find just from my practice, is the most effective on microstructures, so microcirculatory, and then the micro nerves, so the tiny blood vessels. So any of my neuromas and my neuropathies, I would use a lot of red light therapy. So that combination I absolutely love. He adds on that I had a subtalar joint fusion, 20 years, had a full ankle arthroplasty surgery this past summer. Will never get more than 10 degrees inversion, eversion, hoping to have more plantar flexion, dorsiflexion. How would sensory stimulation help with these types of limitations? He asked because he works with seniors, and a lot of the seniors may have arthritis in the ankle or arthritis in the subtalar joint. So that is a little bit more complicated, Jesse. But what I would look at, and that's going a little bit more sensory stimulation for balance and function, because if you have compromised mobility, your balance and stabilization will be compromised because you just don't have that range, that functional range of motion. But you could think of it from the circulation perspective that you need to keep those muscles engaged. If you have less mobility, you have less opportunity for the intrinsic muscles to contract. I would actually go towards vibration, that revitive, obviously Naboso. I would go into that direction for those clients with ankle arthritis, ankle fusions, or in this case, what you're describing, Jesse. Would using hypervolt massage guns work just as well if a vibrating plate isn't available? So I will actually tell patients that if you do not have a whole body vibration platform and you want to use a percussive device, you can. Will it increase the temperature? Is it the same as the frequency and the amplitude? No. But is it better than not doing anything or just rolling your foot on a lacrosse ball? Sure. Part of the way you want to think about it is with the compliancy. So outside of the percussive gun for circulation, I will actually tell patients to put a vibration roller, turn it on, and just set your feet on it. So that type of vibration, I would actually want more than the percussive device, but you could do the percussive very lightly. So it's actually not pounding into the muscles, but just kind of brushing the skin, and you may get some of that microvascular response. Okay. Val asks, will a link to the slideshow be available? You got to email me, info@naboso.com, info@naboso.com. Which full body vibration platform do you recommend? I personally work with PowerPlate. I have a relationship with them. So just letting you know that that is my experience with PowerPlate because I've created content for them. They also use Naboso as their top cover. So I do have that kind of relationship. Other ones, just make sure you look at the direction of the vibrations. You want to make sure that it's multi-directional, and then also make sure that you can alter the amplitude. So low versus high amplitude, and then look at the frequency. Galileo's a really great one as well. It's a different vibration than PowerPlate. Vibe Plate is another one that I've had a lot of patients using. So those are the three top ones that I would recommend. Catherine, sorry, says, my feet hurt due to neuropathy. How is the textured sock going to feel for me? So when people have pain in their feet, there is what's considered a sensory desensitization. So sometimes people that have overly sensitive feet, and this could actually be the case for some of your clients that don't like to be barefoot, you have to actually desensitize them to the stimulus. They're going to start hypersensitive, and you have to keep that sensitive to actually desensitize them. In the case of pain, you can also use other sensory stimulation, other stimuli, pain is a stimuli, right? Other stimuli such as Naboso to then desensitize or kind of trick the brain. It can't think of more than one thing at a time, right? So you're trying to distract and kind of mirror or override the painful sensation of the neuropathy. So Catherine, that's what I would say with that, okay? Will it increase the pressure to my foot and increase my already existing pain? This is why I would play around with the desensitization, and you slowly increase your time to exposure to that. What do you recommend for people who cannot ground normally in the winter? I get that question all the time. You can actually use grounding mats. So I have a PEMF mat in my home, and I use that. The one that I have is by higherdose.com. They have a PEMF mat, and that is essentially a grounding mat. And those are great, great for reducing inflammation. That's really why I use it. Also can be really good for detoxing. There's other grounding mats that can go under mattresses. And then there's a lot of grounding stones that you can wear, different grounding stones. So really good. When and how long to use the socks. So we are positioning the socks as a recovery sock. So we are advising that people start with 30 minutes, listen to your body, see how you feel, take them off. Obviously look at the bottom of your foot and see that the pyramidal indentations, we call that the Naboso effect, and just see, notice how you feel. Do you feel, more aware? Do your feet feel relaxed? Do your feet feel warmer? Do a little assessment, and then wearing them again, wear them a little bit longer, but they are intended for recovery at the end of the day, after you've been on your feet, after you went for a run, after you have a hard workout. And then as you get used to them, you of course can increase your time to whatever makes you happy. Is a lawn with grass okay for grounding surface? Yes, absolutely. How are you sizing the socks? Small, medium, large, extra large. I have a diabetic client afraid to go barefoot inside of their shoes with the insoles. Can they do this, or should they wear a thin sock? We suggest wearing a thin sock if there's any hesitation or concern. Just know that a sock is a barrier between the skin and the texture, and the texture we want to make sure can stimulate deep enough in the skin. Okay. They already lost one toe, so I completely understand. Completely understand. So Denise, I would do a thin sock. If someone has been wearing, say, Hokas, what recommendations do you have as far as making the transition to barefoot styled shoes? I suggest starting with maybe releasing the feet every day, doing foot activation. So that could be obviously Naboso, short foot, do some foot stretches using the toe spacers. We have Naboso splay on our website, and you're essentially just trying to build foot awareness. That's my step first. Step one, foot awareness, foot appreciation, right? Then you can start to transition them into a more transitional shoe. So you're taking away a majority of the cushion, not completely to barefoot and zero drop, but you find kind of that transitional shoe. Ultra is one of my favorite transitional shoes. There's various others, technically, like the Nike Free could be transitional. Some of the New Balance ones could be transitional. So find that middle ground, and then you're there. And then as they start doing their minimal shoe movements, release the feet continuously, keep stimulating, maybe put the Naboso texture in the ultras, and then do foot strengthening exercises. And then after you do that for a period, then you go into completely barefoot, minimal, zero drop if they desire. If they don't, stay transitional. There's absolutely nothing wrong with transitional. But if you are going to stay in the Hokas, I say to put the Nabosos inside. Okay. What is your suggestion for Revitive Pro or Medic? Revitive Pro. So Jesse's asking about which of the Revitive devices. Go with the most basic. Go with the most basic. You don't need the bells and whistles for this device, which I think is the Revitive Pro. Okay. Great questions. Okay, so there are a couple more. If you have them, type those in. Otherwise, thank you guys so much for being a part of this. So let's see. Please email info@naboso.com for it. How much will the socks cost? Oh, so the socks, we have ankle height and knee height that we are launching. The ankle is 60. The knee height is 75. Now with these socks, these are not socks. These are not something that is to be compared to Bombas. Okay, love Bombas, love Bombas. This is a recovery tool. Okay, it is a recovery tool. You could say it is a therapeutic tool. It is something that has a benefit beyond just a sock or just beyond any other compression sock that is on the market. Our compression, you will see when you order them, is in a very specific place. I wanted to get enough arch compression to support those intrinsic muscles and get optimal textural stimulation. And then the stimulation or the compression up the leg is also very specific so that we can get that optimal kind of venous return and recovery. But again, it's not just a sock. It is obviously a textured sock, but it is a recovery tool, a recovery device, something that I don't want to call it a medical device, but kind of in that sense. So for your clients that do have neuropathy, Denise, that you had mentioned, right? They can put on the socks, simply walk around their house or do the dishes for 30 minutes. You can even sit on the floor on the couch for 30 minutes with the socks on and get the benefit. So you don't have to be, oh my gosh, I'm going to be walking around in my shoes and I'm concerned. I don't want to get any breakdown in the skin as a diabetic in this example. Okay, awesome. You're going to love them. You will love them. I've been wearing them for the past 6 weeks. I wear them every night and I am definitely addicted to them. So I can't wait for you guys to experience them. So make sure you do reach out to Michael at naboso.com, and then stay tuned. They are hitting the website November 22nd. Thank you all so much. I'm just going to check one last time if there's any other questions. Someone had asked, what do you do when someone has a biomechanical problem? Ooh, that is a very long one. I encourage you to head to ebfaglobal.com. I have dozens of videos and online courses that go into the mechanics. Thank you all again. Stay tuned for our education, for our monthly webinars. Stay tuned for those socks. Stay tuned for an awesome Black Friday sale that we're going to be doing. Thank you so much. Have an amazing day or evening, and I will speak to you very soon. Take care.